Okay. Good afternoon, everyone, and welcome to the Syphilis in Regions Orientation and Update. My name is Lisa Tomney, and I'm part of the Sexual Health and Bloodborne Virus team. I wish to acknowledge the traditional custodians of the land upon which we meet today, the Noongar Whadjuk people, acknowledging their continuing connection to land, sea and community, and pay respects to their elders past, present and emerging, and any Aboriginal people present at today's meeting. Thank you to those who have made their way down here to Royal Street, and a huge thank you to those joining us on VC from the regions. The response and registration for this update have been enormous, and I've had Rudy running around trying to join up people in the regions so that we have enough VC capacity. So thanks for all being really keen and about joining this forum. Can I remind everyone to please have your mics on mute, and also just a reminder that today's presentation is being recorded, and we aim to have the 3 separate presentations uploaded onto the WA SORV website as soon as possible. So firstly today I'd like to welcome Dr. Paul Armstrong. Paul is Director of CDCD and is going to present on the orientation of the outbreak, the public health response and epidemiology. Can I remind everyone again, microphones on mute please.
Ours is further down, but it was here. Can you just put us on speak, get rid of mute?
Parts of Western Australia and in other parts of the country. The first slide here just shows an overview of my talk, which will be discussing the progress of the multi-jurisdictional outbreak, discussion of the epidemiology, how the regions are responding, how the state is responding, and what the next steps are. So this is an epidemic curve of the outbreak in regional Australia in a number of different states and territories, 4 in fact. It started in Queensland, in the northwestern part of Queensland in 2011, and sort of trickled along until middle of 2013, when the first cases in the Northern Territory were reported, and you can see those in the light blue there, and the dark blue is the cases in Queensland. Western Australia started recording an increased number of cases in 2014 that were linked to the outbreak, as shown in red. And in South Australia had their first cases at the end of 2016. This is an epidemic curve of syphilis in Western Australia since 2011, so the same time period as the previous one. And you'll see 2011, 12 and 13 that there was a number of cases each year, less than 1 case per year. And syphilis was fairly well controlled at that time, but you can see in 2014 there's been a steady increase in cases since that time. So the Kimberley was the first region that reported cases that were linked to the outbreak, as I said, in the middle of 2014, and then the Pilbara started reporting cases last year, and the Goldfields this year, and the Goldfields are shown there in the light blue. Also shown there is the Midwest cases. We're watching the Midwest very closely. Lots of travel between those regions, of course, and we're concerned that the outbreak may also spread into the Midwest. So we're looking at that very closely. You can see the purple bars there represent cases in the Midwest. Looking a bit more closely at some of the epidemiological aspects, first of all, the number of cases. It's not 100% clear yet whether the outbreak has plateaued in Western Australia. It certainly seems to have plateaued in the country as a whole. You can see, comparing the Kimberley, Pilbara goldfields there for the first 2 quarters of this year, the Kimberley has had an increase in cases. Whether that's a sustained increase is not really clear. Pilbara is much the same, and the goldfield is much the same as well. Total number of cases is 330 in Western Australia. The age groups, more than 50%, somewhere between 50 and 60% are under the age of 24 years old, with some others up to the age of into middle age. We need to be very mindful of watching this closely, the age profile of the cases, so we know where to target our screening and response efforts. It's a bit early to say whether what the pattern of age group breakdown in the goldfields will be, because there's fewer cases there yet. There's more females affected than males, around 58 to 40%, 42% overall. And importantly, this is really an important point, is about the congenital cases. Syphilis in adults is treatable, but it's a long-lasting effects in babies who are born with congenital syphilis. So this is really the sort of main game here, is to prevent congenital syphilis cases. We've only had one in Western Australia, unlike in the Northern Territory and Queensland, where they've had a number of cases. That child has done quite well so far, but we're really putting a lot of effort into making sure that we can identify and prevent cases of congenital syphilis. And fortunately, that child, as I said, has done quite well to date. Moving on to the regional responses, there's, in each of the regions, there's a syphilis outbreak response team that's been set up. They've developed regional action plans, also syphilis dashboards and targets, the targets aligning to national targets. There's been a rollout of point-of-care testing in the regions at different stages, and also there's been an increase in staffing in the regions. And some of the funding for those new staff has come from the federal government in the ARCHO sector, and also WACS was successful in obtaining some funding this financial year for staffing in the government sector. And also the regions are working on particular priority areas which align to the national priority areas and also the state priority areas, which we'll go into in a second. So moving on to the state response, the Western Australian Syphilis Outbreak Response Group was established in 2018. This group is co-chaired by my position, the Communicable Disease Control Director, and a representative from the Aboriginal Health Council of WA, AQUA. And that's Marion Wood, a public health physician who works for AQUA. This is to really make sure right from the get-go that we have a strong partnership approach between the ARCHO sector as well as the state government controlled sector. The members in SORG are WA Country Health Services, WACS, ARCHOs and other key stakeholders. Whoops, what happened there? Just bear with us for a second. We'll get this.
Participants are now muted.
That's one, yeah. Okay, I'm quite sure what happened there. The terms of reference for the WA SORG are aligned to this group called the Multi-Jurisdictional Syphilis Outbreak, and I'll show you that on an org chart in a second, which is looking at the national approach. And there's cross-membership on the MJSO.
Paul, I think the PowerPoint's not coming through on the remote sites. We've lost it.
Okay, so could everybody bear with us once again? We'll get that sorted out.
All participants are now unmuted.
Can the other, were the other regions seeing the slides then when I was talking last? Can you see that, Charles?
We're seeing it now, thanks, Paul.
Okay, thanks. I was just saying that there's cross-membership on the national committees, which are the governance group, which I'll show you on a slide in a minute, and the multi-jurisdictional syphilis outbreak response group. So this is a chart showing the governance, and this looks quite complicated, and when we're talking about a multi-jurisdictional outbreak with a national response, it sort of needs to be, I suppose. So starting from the bottom there, we have the syphilis outbreak response teams from the Kimberley, Pilbara and Goldfields, the so-called K-sort, P-sort and G-sort. And ARCHO's reporting up to the WA SORG, which reports to the Chief Health Officer, and this is under the Infectious Disease Emergency Management Plan of Western Australia under those arrangements. On the top right-hand side, you can see AHPPC, that's the Australian Health Protection Principal Committee, which is chaired by the Chief Medical Officer of Australia. He also chairs a group, which is a subgroup of that, which has been set up to sort of mount the national response to the outbreak, and that's called the Enhanced Response to the BBV and STI in Indigenous Populations Governance Group, thankfully shortened to Governance Group. So he chairs that, and so that the fact that he is the chair of that, it really shows that there is a high level of commitment from the federal government. And CDNA reports to that group, the AHPPC, and the Multi-Jurisdictional Syphilis Outbreak Response Group is a subcommittee of, or a working group of CDNA. So this is the aims and objectives of the syphilis outbreak response group of WA. It's to control the outbreak of syphilis amongst Aboriginal communities in WA using partnership strategies, and I've bolded that to make to sort of show the importance of that, and that wherever possible, that there is a sustainable control measures for STIs and promotion of sexual health in Aboriginal communities. So this is not just a response to get on top of this outbreak, it certainly is that, but it's also to make sure that whatever measures we put in place are sustainable into the future for the controlling of STIs in remote communities. The objectives are to reduce the incidence of infectious syphilis amongst Aboriginal communities to pre-outbreak levels. I mentioned that was roughly, less than 1 per month. So we've got something to aim for there. To maintain zero occurrence in congenital syphilis among Aboriginal communities in Western Australia, we've already had one case, so we haven't maintained the zero occurrence, but we'll continue to try to keep that as low as possible. And also to develop, enhance and maintain systems, workforce and capabilities with a readiness to prevent spread of syphilis between the regions and to respond to any future outbreaks. So a key output of that WA SORG group has been the development of the Syphilis Outbreak Response Action Plan. This was launched by the Minister for Health in Broome on the 3rd of July this year. There was a broad consultation with around 50-odd people that came to Perth in November last year for a whole-day workshop to develop the framework for that Syphilis Outbreak Response Action Plan. And there's also in development a monitoring framework that goes with the action plan. There's a number of priority areas that are aligned to the action plan, and these also are aligned, as I mentioned earlier on, to the regional priority areas and also the national ones. And there's been a number of working groups, one working group for each of those priority areas that has been set up in Western Australia. So this is just some of the key actions of each of those 5 working groups, and I'll just list them here. This is not an exhaustive list. They're doing more work than this, but these are the main things. So the Prevention, Education and Community Engagement Working Group is looking at the role of social media in helping to control the outbreak with using social media for health promotion means. This group is also scoping existing health promotion and education resources and activities and events in each of the regions, and to see what works and perhaps what doesn't, and where the gaps are, and whether these different activities can be shared between the regions who may not be undertaking them. And also developing resources such as posters and reminder cards for clinics on how to test and treat syphilis. The Testing, Treatment and Contact Tracing Working Group is developing recommendations for testing, and really importantly, including the point of care testing. This is a key part of the response, and it's something fairly sort of new, and we're still trying to understand how it is all going to work. and also recording of tests onto STORK, which is the midwives' data collection for Western Australia, and also recording of patient care information systems such as CHIS in the country. The Workforce Development Working Group that's developed the syphilis SASA, which allows registered nurses and Aboriginal health workers to provide treatment to syphilis cases without the order of a doctor. They're also arranging training in the regions, mapping of the regional sexual health workforce with an emphasis on the role of sexual health coordinators in the regions, and also involved in social media training. Surveillance and Reporting Working Group, developing the syphilis register for Western Australia. We've been successful in getting some funding from the state government to develop that. They're also have developed a communique which will be going out periodically, examining the barriers that are affecting the timely patient information sharing between regions and between towns when people move around, to make sure we know where people are, but keeping mindful of the privacy concerns as well, and also developing the monitoring framework. The final working group is the Antenatal and Postnatal Care Working Group, which is involved with modification of the STORK database to make sure that the syphilis testing for pregnant women in postnatal and prenatal care is recorded appropriately. They've developed a sticker for the handheld pregnancy record to remind people that what the testing requirements are. They've developed an investigation protocol for congenital syphilis following the investigation of that single case of congenital syphilis in Pilbara, and developed a protocol from that to make sure that we know what we should be doing the next time if it does occur. And then the revisions of the KEMH shared care guidelines and the WA Silver Book to align those with national pregnancy care guidelines. So next steps, the working groups will continue. They've got some short-term actions that are itemised in the action plan, and some longer-term actions as well. Funding for outbreak regions, we've been, as I said, successful in getting some funding for FTE in outbreak regions and centrally here to develop a syphilis register, and also for health promotion activities in the regions. We at CDCD have commissioned a group to undertake social media training in the regions. The Kirby Institute in Sydney has looked at what we need to do to get on top of this outbreak from a national perspective, using infectious disease modelling, and we'll be seeing a report from them, or a presentation from them tomorrow, and to work out how we incorporate that into our response in Western Australia. And then the upcoming ASHM symposium in Western Australia, there will be a syphilis symposium there, but we'll be talking about the response to the syphilis outbreak. Thank you very much.